Today, we're going to start our workshop with a fireside chat featuring Dr. Eric Topol, one of the world's most inspiring leaders on digital innovations in medicine. Dr. Topol is a founder and director of the Scripps Research Translational Institute, a professor of molecular medicine and executive vice president of Scripps Research. He has published over 1,200 peer-reviewed articles with more than 300,000 citations. He's one of the top 10 most cited researchers in medicine. He's a member of the National Academy of Medicine, and his work has focused on individualized medicine using genomic, digital, and AI tools. Dr. Topol has written 3 best-selling books on the future of medicine, including Deep Medicine: How Artificial Intelligence Can Make Healthcare Human Again. He's the principal investigator for 2 large NIH grants, the OFS Research Program and the Clinical and Translational Science Award. He's the founder of the Lerner College of Medicine and Cleveland Clinic, was commissioned by UK to lead a review of the National Health Service. At the same time, he's still active clinically as a cardiologist. As if that's not enough to keep him busy, Dr. Topol is also the editor-in-chief of Medscape, publishes the newsletter Ground Truth, and maintains a strong presence on Twitter with about 700,000 followers. Dr. Topol, I want to admit that I am also one of your Twitter followers, and I want to thank you for your effort to protect public health during this pandemic. Today, I'm really looking forward to learning more from you. To start a conversation, could you please tell us what inspired you to start working on the use of AI and machine learning in precision medicine? How did this journey begin for you?
We're seeing a lot of data accumulate from various sources like genomes, electronic health records, images, gut microbiome, environmental sensors, and wearable sensors. And so we didn't have a way to analyze the data. And AI really looked like a potential solution. So that's what got me into that whole domain some years ago.
Thank you, Dr. Topol. That makes a lot of sense. Thank you for sharing. In your book, Deep Medicine, you discuss the potential of AI to revolutionize the practice of medicine. In your view, up to now, what are some of the most inspiring examples of application of AI and machine learning in precision medicine?
When I published a book back in 2019, so we're heading towards 4 years ago now, we were starting to see deep learning take hold, particularly in medical images. So all forms of X-rays and MRIs, CT scans, but also slides for pathology, electrocardiograms, retinal photos, skin lesions. All these things were showing promise that with large data sets to train annotated images, supervised learning, you could get accurate interpretations that would match that of experts. And then with the combined interpretation, the best of all worlds. So those were studies that were supportive. They weren't necessarily definitive proof because they're retrospective. But now, since that time, we've seen many prospective studies, even randomized trials, for example, of diagnosing polyps with machine vision during endoscopy or colonoscopy, as a good example of how our medical imaging interpretation for accuracy can be augmented with AI.
Thank you, Dr. Topol. That's very helpful. AI for medical imaging data have definitely gained a lot of attention. Do you think this is the most promising area for the application of AI in precision medicine? And do you think this AI applications has led to improved patient outcome?
Still waiting to see about big improvements in patient outcomes, but no question in terms of accuracy of image interpretation, there's definitely been ability to jump forward. I mean, we've seen that particularly in certain areas, like in ophthalmology, interpreting retinal photos and OCT images of the eye. But also we've seen it, as I mentioned, in gastroenterology, radiology, pathology. So for example, there's each of these images has much more layers of rich data than we appreciated. I'll give you an example. The retina is a gateway to get a handle on blood pressure control, glucose control, hepatobiliary disease, kidney disease, Alzheimer's disease. And the electrocardiogram, we could get the hemoglobin, the age and sex of the patient, ejection fraction, valvular heart disease, and many other. So the point being is that we didn't appreciate how well AI tools can be trained when you start to put in annotated images of 100,000, 1,000,000, and on. So we're learning that there's many things that machine eyes can see that human eyes can't, even expert human eyes. And that's why they're very complementary. But yes, images are the first frontier. Obviously now we're moving towards foundation models, which give us the ability to integrate speech and text. And that will be the next chapter of how that affects medicine in the years ahead.
That's very enlightening. It's actually a perfect segue into my next question. AI and machine learning can be used together with digital health tools, such as wearable sensors, to monitor and analyze patients' health or even activity data in real time. So how do you envision this will impact precision health, precision medicine, and healthcare?
What you're bringing up is also still a challenge. That is to fold in the continuous data for things like vital signs, heart rhythm, as an example, or analytes like glucose into the multi-layered data of a person. We haven't really cracked that yet. That's actually one of the big challenges of multimodal AI that lies ahead. We've seen where you combine electronic health record and genomics. So just, 2 layers, but to get to as many layers as would be considered that are the components giving you a better handle on the uniqueness of an individual, we have a ways to go. Our analytical capabilities are not commensurate with the challenges that lie ahead or even present now.
Thank you for touching on some of those big challenges and obstacles. I'm wondering if you can talk about how these challenges compare to those faced by other fields that use AI and machine learning, such as finance or transportation.
We're always the laggard. These other sectors get ahead of us, partly because there's more AI talent that is working in tech, finance, and other sectors, and also because medicine is much more resistant to change. Even all these several years now of deep learning, we've had minimal implementation. Part of that is that we have various proprietary algorithms of companies that never get published in mainstream peer-reviewed literature. They get 510K approval at FDA, but the data is not transparent to the medical community. There's reluctance to implementation. There's a cost to put these algorithms in health systems. And then in addition to all of that, there's lack of surveillance. So if you have a algorithm that's been given clearance by FDA and has now been purchased to use at a health system, what happens if there's an adversarial attack or a software glitch that can occur, as we are very familiar with any type of software? And that can hurt people at scale. So we don't even have surveillance systems. We haven't kept up with the ability for hacking and losing a breach of data in health systems nearly as we should. And now we have yet another dimension of challenge, which is surveillance after the use or implementation of an AI system.
Thank you so much, Dr. Topol, for sharing your thoughts on that. That's very helpful. My next question is, can you discuss some of the ethical, legal, and regulatory concerns surrounding the use of AI and machine learning in medicine and how they can be addressed?
Well, there's no shortage of concerns like that, and they're at different levels. There's concerns about bias. That is, what are the inputs that led to the model to be tested and validated? And if it's not inclusive of all different race and ethnicities, for example, or if it's skewed towards some type of demographic, whether it's age or whether it's socioeconomic status or whatever it is, it diminishes our ability to extrapolate. So bias, which is not necessarily the problem with the model or the neural network, it can be embedded in the culture, as we've seen with the very well circulated Optum in Science report. We've seen it in multiple examples with knee osteoarthritis in Blacks as compared to the 1950 coal miners report that shaped the criteria for diagnosis of knee osteoarthritis. We've seen it with skin lesions or pulse oximetry, where the data are only been shown to be validated in people of European ancestry. So that's one dimension, which is bias. And that relates to fairness and discrimination, because if you start to apply such a model broadly, when you only have narrow inputs, you've got a problem. There's the regulatory issues that are concerning as well, because of the proprietary nature of these companies that don't want to make their data and their algorithm transparent. The medical community is, the default is lack of trust, because they actually, to treat patients, to make decisions and diagnose patients on the basis of something that is a black box is a problem. And so, unfortunately, there's not enough regulatory teeth to mandate that this data is widely shared by the medical community. But there are many other factors as well here about ethics, because what is this going to do to drive inequities worse if it's only used by people of affluence? We have good examples that we could actually reduce inequities with AI. My favorite example is the smartphone ultrasound, where it can be used to acquire images of any part of the body except the brain. And the AI can help an untrained person, even the patient, to get a high quality image with auto capture, and then even beginning the interpretation or just transfer to the doctor. So we're seeing with imaging a really great example of ability to reduce inequities, because this is being used in the hinterlands of the world, in Africa, India, and many other places in rural venues where there's no skilled medical professionals to do this work. And here you're getting high quality, high resolution imaging through a smartphone. So these are just some of the things. You could write many volumes of books about the problems of AI, which we have to confront. We have many issues that have not been resolved. And over time, I hope all of them will be systematically addressed. One other one I would mention before wrapping this question up is explainability. And a lot of people say, I don't want to use this unless it's fully explainable. But there's a lot of things in medicine that are not explainable, like how do anesthetics work? How does ECT for severe depression work? Many things we have no idea how they work, but we use them and use them oftentimes without even questioning. Well, here we have the potential of AI to deconstruct the network, to understand the saliency of what features is driving the ability to interpret accurately. But we may not always be able to understand that. And the question is, should we not use the AI when it's been fully validated and otherwise has extremely high accuracy across all the different venues and people and everything you could ask for? So this is another issue that keeps coming up. And frankly, I don't really understand why we would hold our AI to such a much higher standard than we do with medicine, but we'll have to see how that all plays out.
Yeah. Thank you. That's very insightful. And could you also talk about how can security and privacy of patient data be ensured when using AI and machine learning in precision medicine?
Well, yeah, we don't do well for medical privacy and security overall. And that's why we have so much problems with thievery, cyber hacking, and a breach of our data. A very substantial proportion of Americans have had their data breached at least once now. So how can AI make that better? Well, of course, there's lots of ideas that have been built on AI tools, such as federated learning, such as swarm learning. Privacy computing is a very hot area right now. Edge computing, such that the data never leaves a smartphone. It's not have to be migrating out to a cloud analytic. It does look promising that AI can help with privacy computing to get us to a tighter, it'll never be perfect, but to approaching better levels of security and privacy of medical data, which is so precious. We are still waiting. I mean, homomorphic encryption and all these different ideas are out there with examples, but they haven't been widely implemented and tested.
Thank you. That's very informative. Now let's move on to the next question, which is, in your opinion, how will AI and machine learning transform the field of medicine and healthcare over the next decade?
Well, there are a myriad of opportunities. And, you know, we talked about accuracy of medical image interpretation being kind of the first base here, but it goes well beyond that. So for natural language processing, we should be able to liberate from keyboards as clinicians. We've already seen great examples of synthetic notes based on the conversation between the clinician and patient, whether it's in the clinic or the bedside, to make superior notes, that is, compared with what we have today that are from these Epic, Cerner, and other information tech systems. Now, we have such extraordinary ability to empower patients to help take their data that they capture, whether it's through a sensor, whether it's through a combination of that data and their environment and their electronic health record, but that is to give that patient ability to take charge on common diagnoses, like a child's ear infection, a skin lesion or cancer, potential urinary tract infection, heart rhythm abnormality. The list goes on and on of common abnormalities, but also we're seeing now coaching across most chronic conditions, hypertension, depression, diabetes, and the list is getting longer all the time. So eventually we will get to the virtual medical coach, which will give the patient much more charge, and those who are willing to take on that responsibility, which is something that many people are eager to have more direct involvement in their care. So there's lots of ways as we go forward, eventually even coming to the point of having digital twin infrastructure, so that when I have a serious new diagnosis, I can find my nearest neighbors at every level to know what would be the best treatment and outcomes, which would be complementary to how we make those decisions today based on clinical trials. So it's an endless thing, but to me, the greatest of all is the ability to recreate the patient-doctor relationship we used to have decades ago when I was getting out of medical school in the late 70s, early 80s, when it was a precious relationship. And why did we have that? Well, mainly because of the time we would have with each patient. And now that's been cut into, you know, just a handful of minutes, single-digit minutes typically. And that's not enough time to really listen to a patient, to be able to do a careful exam, to be able to communicate and have presence and trust. And so we've got to get that back. And between all these things we discussed, liberation from keyboards, synthesis of a patient's data from multiple sources, giving patients more charge, and various other things, we should be able to get the gift of time. And to me, this is the overarching goal, that we get restoration of the patient-doctor relationship. To me, that's more important than anything else we've discussed.
Thank you. And one more question. So what do you see as the most important skills and knowledge needed for professionals who want to apply AI and machine learning for precision medicine? And how do you think our education system should adapt to prepare the next generation of professionals in this field?
Well, unfortunately, we're not adapting. We know now already, I mean, every day now, all we hear about is foundation models, chat GPT, stable diffusion, and we're already seeing with MedPalm, the ability to get very high scores on the US medical licensing exam. I mean, things are happening quickly, but what do you see in medical schools, in the curriculum? Nothing. What do you see for continuing medical education for AI? Almost nothing. So we have several 100,000, almost 1 million practicing physicians in this country, no less other healthcare professionals, where there's no education, no continuing education. Not that we want clinicians to become AI experts, but enough to be able to understand what are neural networks, what are the nuances, how can they help, how can they be erroneous, how are they limited? These are things that should be core curriculum for all clinicians, but we take much too long to have this happen. And this is really unfortunate. It needs to go into an accelerated path right now.
Thank you. And one last question. Do you have any advice for people who are interested in this field on how we could turn AI and machine learning from buzzwords to business as usual in our organizations?
Well, someday it will become part of the embedded practice of medicine. We're a long way from that right now. We've barely implemented anything compared, if you were to look at what's been published, what's been cleared at FDA. We're in the early stages still. We move slowly in medicine. Someday, maybe in the way things are moving, it may take decades, this will become integral to all medical care. Today, what we'll see is the business where you can eliminate or markedly reduce back office operations with AI, things that are being able to work on not the front lines of medicine, but things in the back, administrative aspects, hopefully reducing the cost of healthcare. Someday we'll not have to use hospitals as we know them today, because we will be able to get people at home if they didn't need an intensive care unit or an emergency room or an operating room. They should be able to be cared at home exquisitely with sensors and analytics to be able to predict if they're having trouble at home, to intervene if need be, whether a visit to home or actual transfer into a medical facility. So we will see many ways going forward, but each one takes quite a long time. And hopefully this will not be like many other things in medicine, where it has taken much too long to become integrated to a state of the art, state of medical care.
Thank you. Thank you. Thank you so much, Dr. Topol. I think we've reached the end of our time for the fireside chat. We've covered a lot of ground today, and I want to thank you for sharing your insights with us. It's a great pleasure talking with you today, and look forward to following your future endeavors. So this concludes our fireside chat today, and thanks everyone for joining us. Now I will turn back to Dr. Joga Gaburo to start the first session of today's workshop. Thank you.
Thanks very much for having me.